Last month I talked to you about how some of our advanced hormone replacement techniques here in the center are helping many, many individuals. Now, we use bioidentical homeopathic hormone creams. Now, I wanted to bring your attention to a couple of facts that are occurring right now, and one of those is something that I spoke to you about a long time ago and was actually researched in the 1930s by a Dr. Pottenger. And Dr. Pottenger did his research on cats, and what he found was that generationally, if those cats ate improperly, that their fertility rates and other physiological functions would deteriorate to the point where they become infertile. Well, this is now happening to us, gang, and we're finding that fertility rates are decreasing significantly. As a matter of fact, I treat a number of patients routinely in the center here who have already been through all the fertility stuff and still are not pregnant. And if you look at our testimonial videos, you'll see those of a few people who have gotten pregnant through what we've been able to help them with here at the center. So let's look at some of the statistics, and I just want to read off a few to you. Between the ages of 18 and 25, abnormal sperm counts are already found in males. That's really young. That's when most males should be virile and able to do reproductive capacity, but they're not at this point. Between 5 and 15% of these individuals' sperm, on average, is good enough to be classified as normal by the World Health Organization. Now, 5 to 15% of these individuals, that's a low percentage. I mean, in farm animals, if we look just at farm animals, they're 90 to 100% active sperm. These individuals, 18 to 25 years old, have 5 to 15% active enough to be able to reproduce. So we have to kind of figure, why is this happening and where is it coming from? Well, there are a number of factors. There are environmental factors that I mentioned last time in my last video. There are also factors that are generational now. So like Pottenger's cats, we are starting to see generational changes in fertility rates that are caused not so much by what we're doing, but what our mothers or our parents had done. And so the ability to manufacture and produce sufficient sperm in males is reduced by what happened the generation prior. Now, what do you do about it now? Well, one of the things that you must do, and most of these individuals have problems with, is their estrogen levels are too high and their testosterone levels are too low. The way we compensate for that here in the center is we utilize detoxification and cleansing to get rid of the xenoestrogens and all these external environmental estrogens that are causing the estrogen levels to go too high, and we supplement with our bioidentical homeopathic hormone creams, particularly testosterone, to elevate those testosterone levels and get these individuals functioning correctly again so that they can reproduce. They can have a normal lifestyle. They don't have the fatigue, lack of muscle mass, increased abdominal girth from fat that's positive because their testosterone levels aren't high enough. So to learn more about it, give us a call here at the center, 215-679-WELL. Email us if you have questions. We can send you more information. I want you to learn more about this subject and topic because it's germane right now and important, and I feel that we're really at a tipping point where we've got to make the changes that we need to in order to bring these situations and these levels back up. I want to remind you that we're having our cholesterol seminar this month. It's pretty much filled up, but we do have a few slots left, so if you'd like to come, feel free to give us a call. Again, 215-679-WELL, and sign up for it. Listen, study, learn, and keep improving your health. Watch your eat right, think right, move right, and sleep right, and you'll do that. So thanks. I'll see you next month.